Here in New York, 7,000 nurses in New York City's hospitals are on strike over pay and staffing. They want better working conditions. Many medical facilities have postponed procedures and appointments due to this, and fears are growing that things may even get worse. Enough is the theme as protesting nurses came out with their demands over contract negotiations and staffing levels at hospitals. The nurses' strike in New York comes almost simultaneously with strikes by nurses and paramedics in the UK.
So the nurses at Mount Sinai have basically come together to say that we're tired of being exploited, we're tired of our patients being abused, and most of all, we're tired of seeing them not get the care they deserve. We came into nursing to take care of people because we care about them. We come from compassion. And it's very difficult to come into the hospital every single day and know that we're not able to give them the care that they truly deserve. These hospitals have shown that all they care about is profits, but we are no longer treating patients like transactional items. They are people and they deserve respect, and that's why we're out here striking. It's not about money, it's actually about saving lives.
Sick and tired of the hospital only doing the bare minimum for us nurses. Time and time again, we are forced to take unsafe patient loads.
Management should be ashamed of themselves. They put these nurses in this situation. I do not know how they sleep at night.
After failing to reach a contract agreement on Sunday, the nurses from Mount Sinai's main hospital on the Upper East Side and Montefiore Medical Center in the Bronx went on strike. The New York State Nurses Association said it was being forced into the drastic step because of chronic understaffing that leaves them caring for too many patients. The walkout involves as many as 3,500 nurses at Montefiore Medical Center in the Bronx and around 3,600 at Mount Sinai Hospital in Manhattan. Montefiore and Mount Sinai are the last of a group of hospitals with contracts with the union that expired simultaneously. The Nurses Association had initially warned that it would strike at all of hospitals at the same time, resulting in a potential calamity even in a city with as many hospitals as New York. But one by one, the other hospitals struck agreements with the union as the deadline approached. Mount Sinai's administration said that the union's focus on staffing to patient ratio ignores the progress they have made to attract and hire more new nurses, despite a global shortage of healthcare workers that is impacting hospitals across the country. If the nurses strike, patients are likely to see disruptions in care, such as emergency room visits and childbirth.